Have you ever had a health challenge and said these words? Well, it's just because I'm getting older. Many people love to blame their health challenges on aging, and most of the time, that's a cop-out. Most of the time, their health challenge isn't because of their age, it's because of poor lifestyle, which would include all sorts of things from nutrition to stress to toxins to poor sleep to physical inactivity, etc. But in the case of immune disorders, especially chronic infection, then they may be onto something by saying it's because they're getting older. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. If you have chronic infection or worsening autoimmune disease, etc., and you are age 50 or older, then blaming your issue on your age is partially true. The age does play a role as we reach 50 plus years old, because there is a normal physiologic senescence or decline in immune function as you age 50 plus, specifically in the Th1 arm of the immune system, which deals with infections, specifically viral infections. So if you, as you age, realize that you are sick more often, especially with viral infections, then this may be affecting you. Or if you're someone with a history of viral infection from, say, a herpes family virus, like Epstein-Barr virus, cytomegalovirus, human herpes virus 6, herpes simplex 1 or 2, if you notice that as you've reached 50 plus, you have more flares, more oral sores or genital sores, or more fatigue, etc., related with these different viruses, it may be tied to the physiologically normal senescence of your Th1 immune system. Now, just because there's a normal physiologic decline doesn't mean that we can't slow that or prevent that or reverse that. And this brings in, again, lifestyle, nutrition, physical activity, stress reduction, sleep hygiene, toxin avoidance, all the things that if you have a normal physiologic decline of that immune function and all of those other factors are terrible, your lifestyle is terrible, well, that's going to pile on and be an abnormal contributor to a speedier decline of that immune function. So we want to optimize or have as slow a decline as possible by living an optimal lifestyle. And then there's nutrients that we can use to oppose or slow or reverse that normal physiologic decline. So that's what I want to dive into. Now, if we're aging and we're 50 plus, as I said, there's the normal physiologic decline, which results in decreased Th1 immune function, which is the big time antiviral or anti-infection portion of your immune system. Now, studies have shown that there are many nutrients that can oppose this decline. So many patients have said, well, why do we have to take supplements for our whole life? Is it necessary to take supplements for our whole life? Well, where we are today in America in 2018, and the state of our soils and the toxicity of our environment and the stress levels we deal with, absolutely we all need some form of supplementation. What each person needs is going to be individualized to that person, but in general, we all need a quality multivitamin, multi-mineral supplement. And even the Journal of the American Medical Association has stated that all adults need to supplement with a quality multivitamin, multi-mineral. Why? Well, one reason is this immune decline with aging. Now, if we have a quality multivitamin mineral, that's providing many of the nutrients that will oppose or slow down or reverse this senescence. What are those? Well, zinc is one, selenium is one, vitamin C is one, vitamin E is one, and glutathione is one. All of these will oppose that senescence. and a quality multivitamin mineral supplement is going to contain all of these. Now, will it contain enough to have the effect in that each individual needs to oppose this? Likely not, because each individual has other contributing factors, but at least it provides a baseline of supplementation for you to keep you afloat, so to speak, until you can work with a practitioner that can dive into your case, look under your hood specifically, determine your nutrient levels, the state of your immune system, and then tweak the dosing specific and relevant to what you need. So if you're middle-aged, 50 plus, and you've noticed that your herpes family viral flares are occurring more often, or every winter you catch the flu or the common cold or whatever virus is going around, you may be dealing with the normal aging senescence of your immune system, and then if your lifestyle is poor, that's piling on and accelerating that senescence. So we want to clean up your lifestyle to slow that acceleration, and then make sure you're sufficient with the nutrients you need to halt, slow, or reverse that process. That research has shown these nutrients can take elderly people, or elderly would be 50 plus in this case, but immune senesced people, and return their immune function to healthy young adult levels just by supplementing.